Could the next global pandemic be lurking in the slowest creature on Earth? While sloths are known for their leisurely pace and peaceful existence high in the treetops, these gentle creatures may harbor a hidden danger that is far from slow in its potential impact. Recent reports have brought attention to a virus originating in sloths, known as the Oropouche virus, that has begun to spread beyond its native regions in Central and South America, reaching as far as Europe. This virus, transmitted by the bites of infected midges and possibly mosquitoes, could be the next significant public health threat. As the world grapples with the ongoing repercussions of past pandemics, the emergence of the Oropouche virus in new territories is a stark reminder of how interconnected and vulnerable our world has become. Join us as we delve into the science behind this virus, its origins, and what it could mean for global health. What is Sloth Fever Virus? Sloth Fever Virus refers to the Oropouche virus, Orov, a debilitating virus that has recently gained attention due to its spread to Europe. Originating in pale-throated sloths, non-human primates, and birds, the virus is primarily transmitted to humans through the bites of infected midges, particularly Colicoides pariensis, and potentially through mosquitoes like Culex quinquefasciatus. Oropouche virus belongs to the Orthobunyavirus genus, which is the same family as other notable viruses like Zika and dengue fever. While Oropouche virus has long been present in South and Central America, causing several outbreaks in countries like Brazil, Bolivia, and Peru, it has now been reported for the first time in Europe, with 19 cases identified in Spain, Italy, and Germany. These cases were primarily linked to travel to Cuba and Brazil. The virus typically manifests as an acute febrile illness with symptoms including headaches, nausea, vomiting, muscle and joint pains, and, in some cases, more severe symptoms such as aseptic meningitis or neurological complications. Despite the often painful symptoms, the prognosis for recovery is generally good, with fatal outcomes being extremely rare. However, there is no vaccine or specific treatment available for the virus, making prevention through vector control and personal protective measures crucial. Given the recent outbreaks and the concerns raised by health officials like Dr. Danny Altman, there is a growing concern that the virus could become a more widespread threat, particularly as the changing global climate and increased human interaction with wildlife may facilitate its spread to new regions. How did it emerge? Oropouche virus, Orov, is an emerging zoonotic pathogen responsible for Oropouche fever, primarily transmitted by the biting midge Colicoides pariensis. The virus has caused numerous outbreaks in South America, particularly in Brazil, Peru, and other Latin American countries. Understanding the factors contributing to the emergence and spread of Orov is crucial for public health management. Key insights. Transmission and vectors. 1. Orov is mainly transmitted by the midge Colicoides pariensis, which plays a significant role in both urban and sylvatic transmission cycles. 2. The virus has also been found in various mammals, suggesting multiple reservoirs that contribute to its transmission. Geographic spread and outbreaks. 1. Orov has caused over 30 epidemics in Brazil and other Latin American countries since the 1960s, with significant outbreaks reported in Brazil, Peru, Panama, and Trinidad and Tobago. 2. Recent outbreaks have been documented in previously non-endemic areas, such as the western region of the Peruvian Amazon and French Guiana, indicating the virus's expanding geographic range. Evolution and genetic diversity. 1. Phylogenetic and genomic analyses reveal that Orov has a complex evolutionary history, with evidence of cryptic reassortment and positive selection on viral surface proteins, which may influence its adaptability and spread. 2. Different RNA segments of the virus show distinct evolutionary patterns, suggesting that the virus's genetic diversity is shaped by various evolutionary forces. Underreporting and diagnostic challenges. 1. Orov is likely underreported due to its clinical similarity to other febrile illnesses like dengue, chikungunya, and Zika, and the lack of specific diagnostic tests. 2. Improved molecular diagnostics and surveillance are needed to better understand the virus's prevalence and impact. Environmental and ecological factors. 1. Habitat loss and environmental changes can increase the likelihood of Orov emergence by altering the distribution of vectors and reservoirs. Symptoms and effects. Common symptoms. 1. Headache, myalgia, muscle pain, and arthralgia, joint pain, are the most frequently reported symptoms in Orov infections. 2. Other common symptoms include retroocular pain, hyperexia, loss of appetite, nausea, and dizziness. Severe symptoms and complications. 1. Some patients experience severe symptoms such as low platelet count, intense abdominal pain, and thoracic pain. 1. 2. Orov can affect the central nervous system, leading to aseptic meningitis and meningoencephalitis, although these cases are less common. Pathogenesis and immune response. 1. Orov infection induces oxidative stress and inflammation in the liver and spleen, characterized by increased reactive oxygen species, ROS levels, and pro-inflammatory cytokines 4. 2. The virus can spread to the central nervous system, initially affecting the spinal cord and brainstem before advancing to other brain regions. Epidemiology and transmission. 1. Orov is primarily transmitted by the biting midge culicoides pariensis, with no evidence of direct human-to-human transmission. 2. The virus has been identified in various mammals, suggesting a complex sylvatic cycle. Diagnostic challenges. 1. The clinical symptoms of Orov are nonspecific and overlap with other arboviral diseases like dengue, Zika, and chikungunya, complicating diagnosis. The global threat. Epidemiology and outbreaks. 1. Orov has caused over 30 epidemics and more than 500,000 clinical cases in countries like Brazil, Peru, Panama, and Trinidad and Tobago. 2. The virus is primarily found in Brazil, with significant outbreaks reported in the Amazon region and other parts of the country. Transmission and vectors. 1. Orov is transmitted by the biting midge culicoides pariensis and various mosquito species. 2. The virus has a sylvatic cycle involving non-human primates and sloths as reservoir hosts. Clinical presentation and diagnosis. 1. Orov infection presents with symptoms similar to other arboviral diseases like dengue, chikungunya, and Zika, making it difficult to diagnose. 2. Cases of aseptic meningitis and meningoencephalitis have been reported, indicating potential severe manifestations. Geographic spread and potential for expansion. 1. Orov is spreading across Latin America, with cases reported in Argentina, Bolivia, Colombia, and Ecuador. 2. Environmental changes like deforestation and climate change may facilitate the spread of OROV to new regions, including North America. Genetic diversity and evolution. 1. Orov exhibits significant genetic diversity and reassortment, which complicates its surveillance and control. 2. The virus has been found to evolve under natural selective pressures, with implications for diagnostics and vaccine development. Public health and control measures. 1. There is no specific antiviral treatment or vaccine for Orov. Prevention relies on vector control and personal protection measures. 2. Increased urbanization and habitat loss may lead to more frequent outbreaks, highlighting the need for improved surveillance and diagnostic tools. What can be done? Preventative measures. To mitigate the risk of an Oropouche virus outbreak, several research efforts and preventative strategies are currently being employed. 1. Vector control. Since the Oropouche virus is primarily transmitted through midges and mosquitoes, controlling these vectors is crucial. 1. Efforts are being made to reduce their populations through environmental management, such as eliminating standing water where mosquitoes breed, and using insecticides in high-risk areas. 2. Surveillance and monitoring. Health organizations are enhancing surveillance systems to quickly identify and respond to outbreaks. 2. This includes monitoring regions where the virus is endemic and where cases have recently emerged, like Europe. 2. Improved diagnostic tools are also being developed to facilitate rapid detection. 3. Public health campaigns. Education and awareness campaigns are being launched to inform the public about the virus, how it spreads, and the symptoms to watch for. 3. These campaigns are crucial in both endemic areas and regions where the virus could potentially spread. 4. Research and vaccine development. Researchers are actively studying the Oropouche virus to better understand its transmission dynamics and to develop a vaccine. 4. Although no vaccine currently exists, the ongoing research is a promising step towards preventing future outbreaks. 5. Travel advisories and health warnings. Given that recent cases in Europe were linked to travel in affected regions, authorities are issuing travel advisories. 5. These advisories recommend that travelers to endemic areas take precautions to avoid insect bites and seek medical advice if they develop symptoms after returning home. What you can do. While larger-scale preventative measures are being taken, there are several steps you can take to protect yourself and stay informed. 1. Protect against insect bites. Use insect repellents containing DEET, picaridin, or oil of lemon eucalyptus, especially when traveling to areas with known Oropouche virus activity. Wear long-sleeve shirts, long pants, and shoes that cover your feet to reduce skin exposure. Sleep under insecticide-treated bed nets, especially in areas where housing may not have screens or air conditioning. 2. Stay informed. Follow updates from reliable sources such as the World Health Organization, WHO, or the Centers for Disease Control and Prevention, CDC, about Oropouche virus and other emerging infectious diseases. If you plan to travel to regions where the virus is present, consult with travel clinics or health professionals for the latest advice and recommendations. 3. Know the symptoms. Familiarize yourself with the symptoms of Oropouche virus, which include fever, headaches, muscle and joint pains, and nausea. If you experience these symptoms after traveling to an endemic area, seek medical attention immediately. 4. Support research and conservation efforts. Contributing to organizations that fund research on emerging viruses can help accelerate the development of vaccines and treatments. Support conservation efforts that protect natural habitats, as disrupting ecosystems can lead to increased human-wildlife contact and the spread of zoonotic diseases. By taking these precautions and staying informed, you can play a role in preventing the spread of Oropouche virus and protect yourself and your community from potential outbreaks. Final thoughts. In this video, we've explored the emergence of the Oropouche virus, also known as the Sloth Fever Virus, which has recently spread beyond its native regions in Central and South America to Europe. Originating in sloths, non-human primates, and birds, this virus is transmitted through the bites of infected midges and possibly mosquitoes. We've discussed the virus's symptoms, its potential to cause severe health issues, and the challenges in diagnosing it. We've also highlighted the global threat it poses, particularly as it continues to spread to new areas. Finally, we've outlined current preventative measures and provided practical advice on how you can protect yourself and stay informed. As we navigate an increasingly interconnected world, it's more important than ever to stay informed about emerging health threats. Share this video to help raise awareness about the Oropouche virus and its potential impact. By staying vigilant and supporting wildlife preservation efforts, we can help mitigate the risk of future outbreaks. Together, we can contribute to global health and protect our communities from emerging viruses. So, could the next global pandemic really be lurking in the slowest creature on Earth? While the idea might seem far-fetched, the spread of the Oropouche virus serves as a powerful reminder of how rapidly new threats can emerge. But with increased awareness, scientific research, and proactive prevention, we have the tools to face these challenges head-on. Stay informed, stay protected, and let's work together to ensure that this virus, like the sloth, remains slow in its spread.